What is going on, guys? Welcome back to episode number 3 of the MedViews series here on CellMed. And today we have the opportunity to speak to first-year medical student Omer Ashruf, who attends Northeast Ohio Medical University, commonly known as NEOMED. As always, just a quick rundown of the biography of the speaker. Omer Ashruf is a first-year medical student at Northeast Ohio Medical University. An Ohio native, Omer was born and raised in the small suburb of Solon, Ohio, and stayed close to home attending the University of Akron as part of a 7-year BS-MD program that he was accepted in from high school. In his first semester at NEOMED, Omer has been selected as a policy delegate for the American Medical Association, elected as community service chair for the Oncology Interest Group, and became a published author in the Department of Anatomy and Neurobiology. His interests range from fitness and nutrition to politics and philosophy. He looks forward to pursuing his position for organized medicine in the coming years. Now, without further ado, let's go ahead and hop right into the interview. Hey, assalamu alaikum, Omar. How you doing, man? Thanks for being on the channel.
Walaikum assalam, Salman. Thanks for having me, man.
Yeah, is there anything in your bio that I mentioned earlier that I may have missed or something that you want to add?
No, I think you covered all the high points. You got everything.
Great. So we're just going to go hop straight into it and start with the first question that I always ask is, what led you to the field of medicine?
Yeah, I would say there's a few reasons that come to mind. First and foremost, and I try not to sound too cliche, but obviously the palpable good that you can do as a physician, that's really unmatched, both at the micro level and at the macro level. So individually with your patients, empathizing for them and caring for them, and then obviously on the macro level as well. So we saw that especially this year more than ever, the national response that the physicians had to the COVID-19 pandemic. So there's really no shortage of good that you can do as a physician. It's a very noble profession, and everything about it is both humbling and rewarding. So that's the first reason that comes to mind. And then second, obviously, is it's an incredibly diverse and unique field. There are certain things that you can do as a physician, certain obligations, responsibility, tasks that you have that are absolutely unmatched, not just in professional occupations as a whole, but especially in healthcare. So let's say if you're a nurse or a PA, you don't get to follow the health of a patient completely the same way that you do if you're a physician. There's a lot of minutia and nuance that you have to deal with as a physician that I think, again, is really rewarding. A lot of critical thinking that comes with it. There's also more instant gratification when you take care of a patient than if you were to do clinical or experimental research. So I think especially in the realm of healthcare, being an MD has so many benefits and a lot of good that you can do. And then the third and final reason, and I'd be remiss not to mention the fact that both my parents are physicians as well. So that absolutely molded me, kind of sculpted my upbringing, and it gave me a very realistic image of what it's like to be a physician. So I saw the high points, the low points, and everything in between. So from an early on, I kind of knew this is what I wanted to do.
Sure, great answer. So something that I mentioned in your biography is you're in a BS-MD program. So why did you choose to do this program, and what benefits did you get out of it as opposed to applying traditionally and going the regular 4 years of undergrad and then 4 years of medical school? And did you find any cons with that program?
Yeah, it's a highly unorthodox system. And I'm realizing that more and more now that I am a first-year medical student. But I think to answer the first part of your question, the benefits that I derive from the program, I think first and most obviously, it's a guaranteed track. And so every year, as medical school admissions go, the process just gets more and more competitive. I think this year alone, applications rose by 18%. So this field is getting a lot more concentrated and also a lot more competitive. So granted, you keep up the minimum GPA and MCAT requirements, it is a guaranteed track, and that was pretty attractive to me. And then the second, and I mentioned this in your first question, was that I knew from an early stage that I wanted to go into the health sciences, and particularly medicine caught my eye. So because I knew from an early stage, I knew coming into high school almost, that kind of also led me. And then the second part of your question, if there's any kind of cons or any disadvantages, there absolutely is with such an unorthodox system. I would say the most obvious is that me and my colleagues, a lot of us are a lot younger. I think the average age of a first year medical student is 24 or 25, and most of me and my colleagues are 20 to 21. So the first disadvantage that comes from that is a lack of experience. A lot of my peers who are direct entry students have a lot more experience through their undergraduate experience. And then also, there's something to be said about emotional development, being thrown into like, I guess, like the fire of med school has its difficulties, especially if it's like this early on.
Sure. So, what extracurriculars were you involved in during undergrad? And I know that you mentioned a few in medical school, if you could expand on those as well.
Yeah, absolutely. Um, because my undergraduate experience was a bit unorthodox. I wasn't too involved, but I tried to find ways to increase my involvement at the University of Akron. I was part of the Muslim Student Association, the MSA. I was part of the College Democrats Club, and I was also very active in volunteering. But that was about it. I think in my first semester at NEOMED, I've found more ways to be more involved. And like you mentioned in my bio, I'm part of the American Medical Association. I'm the policy delegate there. I'm part of the oncology interest group where I do community service work. And then also I'm doing research on the side too. And that's something that I plan to continue come the summer.
You obviously have to keep that minimum MCAT requirement being in this program. So, what did you do to hit those marks and really, knock that MCAT out the ballpark to you to matriculate into medical school?
Mm-hmm. Yeah, like you said, there's a minimum MCAT requirement. So I might not be the most qualified to speak on the subject, but being a year and a half removed from taking the MCAT, I definitely noticed I definitely saw trends in which allowed students to be more successful. First is prioritizing what you need to prioritize and being cognizant of yourself as a student. So what that means is knowing from an early point what your weaknesses are, what your strengths are, and how to address them accordingly. So for myself specifically, the very first thing I did before I opened any books or before I went through any MCAT prep material is I took the shortened practice Kaplan exam. And then that gave me a really early diagnostic score of what I'm looking at. So for me, I noticed that biochem and CARS were a strength, but then chem phys and psych soc were weak points of mine. And so as a result, I catered my study program to focus on what I needed to, and then worked on those. And then also what's really important is the practice material that the AAMC gives you. But of course, like that everyone will tell you that.
So, is there any advice for people that are interested in applying to a BSMD or BSDO program that you would give?
Yeah, I would say half the battle is knowing that you're interested in medicine to begin with. So especially if you know in high school, like more power to you, because a lot of people need a lot of time to know whether it's worth the time commitment, worth the investment, and if it's truly a profession that they're interested in. But I would say specifically, if you are interested in applying to a BSMD program or a BSDO program, do things that will kind of differentiate you from your peers and from your colleagues. I think that's true for high schoolers applying to college, for college students applying to medical school and onward. Do something, put something on your resume that you can truly distinguish you from the rest of the competition.
What is one thing that you liked about NEOMED? And one thing I think you already kind of alluded to, something that you dislike was the being so young and going to medical school. But what's something that you really found benefit out of NEOMED specifically, besides the fact that you are, have that guaranteed seat?
Yeah, absolutely. So the first thing that comes to mind specific to NEOMED is the emphasis on patient care. And what I mean by that, and a lot of residents and attending physicians will allude to this as well, that really early on in your NEOMED career, the school has you focus on, for example, standardized patient interviews, where you kind of learn to empathize and you're familiar with the language that you use when talking to patients. And so every Thursdays, for example, we'll also have clinical experiences where we'll go to a hospital and learn how to interact with patients in a really formal setting. And they're doing this my first year, and we're doing this once a week. So from an early vantage point, you're learning how to communicate with a patient, how to advocate for a patient, and how to care for one as well. So I would say that that's like the most obvious benefit of NEOMED, and that's something that, again, attending physicians and residents have mentioned as well, that they really like how early on, when you come to your clinical rotations and whatnot, you know what you're looking at. And then to answer your other question, one thing I dislike, yeah, I think I covered it early on when I said that the younger you are in medical school, the tougher it is, not just from a mental standpoint or an academic standpoint, but also from an emotional standpoint. There's a level of emotional intelligence and development you need to have in medical school, being able to balance that sheer amount of content, that sheer amount of volume, but then also take care of yourself and prioritize other things in your life that are important to you. Having that kind of baseline time management is really difficult at a young age.
Actually, great answer, because that actually leads me to the next question was, what did you find different from college that you found in medical school, and how were you able to adjust? Something that you just mentioned is time management, if you could expand on that more, as well as other tactics that you use to really adjust in medical school, especially being this young.
Yeah, absolutely. So I mentioned this in the last question. And this is a universal truth. I'm not. This is not what I'm about to say is nothing revolutionary, but I would say that the sheer volume load is an absolute phase change from undergrad to medical school. And I wouldn't say that the content is necessarily difficult. Like, for example, learning about the different types of like cardiogenic, anaphylactic, and like septic shock, like that's not necessarily difficult, but then applying that to a clinical setting, knowing what that has to do with the patient, being able to diagnose it, knowing how to treat it. There's just such a high level of volume, and that in of itself becomes more rigorous. So I would say that that's probably the biggest difference from high school from college to medical school, just adapting to the sheer amount of volume. Again, it's not necessarily difficult, but like you said, having a baseline level of time management is absolutely critical. And to answer the second part of your question, how do I manage my time? I would say that, and this kind of leads to another difference between my collegiate studying and my studying in medical school, is in college, and I'll be completely frank, I definitely fell prey to procrastination frequently. And so in medical school, that's not really an option anymore. As soon as the excuse me, as soon as the content is available to you, you need to be on it. You need to familiarize yourself with that content, preferably before the lecture. Watch the lecture so you can kind of solidify the high points, and then constantly reinforce that information. And then obviously time management works its way in there. Like the adage goes, study smart, not hard. In medical school, you kind of have to do both, but just kind of staring at a textbook for 12 hours of a day isn't the best way to go about it. What I would recommend for high school and college students alike is find a study system that works for you. That was one of the difficulties coming into medical school, finding a study system, a study schedule that was personalized and customized to myself. Because I truly believe that every student is different, every student learns differently, every student processes information differently. So if you can come into medical school already knowing how you learn, what's the best environment for you, how to prime yourself to be successful, you've got a foot up on the competition.
So what does a typical day as a first-year medical student look like for you?
Yeah, to be frank, it's nothing exciting. I have classes from 8 to 12. The first hour from 8 to 9 is a lecture, and that's optional. So quite frankly, I'm usually sleeping through it, and I'll watch it at 2x speed later on through the day. Again, just trying to optimize and be a little bit more efficient. And then from 9 to 12 is what is called peer instruction, PI. And instead of a lecture format, the professors will create questions, and we'll go through those practice questions. This is usually for a grade. And so it will cover what's been covered in the lecture, and then you're reinforcing it with those questions. So from 9 to 12, we're just doing practice questions and that's it. So there'll be a practice clicker question, we'll answer it. The professor will reveal the right answer choice, and then he or she will go over why that answer is correct, and then he or she will also answer any outstanding questions. So that's what my 8 to 12 looks like. After that, I'll get a quick bite to eat, talk to my roommate for a little bit. I try to make it a point to go to the gym. And then after that, once I'm back, it's probably about 2:30. And then most of the day is just either studying, planning out what the day will look like, and planning out what the week will look like. And after that, my day will kind of wind down around 10, 11. I'll be in bed by midnight. The week before the exam is a little bit more chaotic, a little bit more hectic, a lot more studying. The amount of class time that you have decreases during the week. But then obviously the stress kind of ramps up a little bit more. And then the weekends are a lot more chill. Obviously, a certain amount of time is allotted to studying, but there's a lot of socializing that can be done too. You can pursue other activities. So that's a great part about the weekends.
What's one thing that you wish you knew going into medical school that you didn't realize until you started?
To be frank, going into medical school, I was uh, pretty stressed, nervous, and it was just riddled with like trepidation altogether. But I wish that I had talked to some upperclassmen. So I think that's the first piece of advice I would offer. Um, if you're fortunate enough to go to medical school, definitely talk to the upperclassmen and get a general feel for what the first couple of years will look like, and then what the clinical side of it will look come your third and fourth years. Um, so I wish I knew that. I wish I had talked to some more upperclassmen, and that definitely would have brought my stress levels a little bit down, because I'm starting to realize that, yeah, it's a lot of work. You got to put in the time. You've got to put in the effort. That's obvious though. But once you do find a system that works for you, it's really just like clockwork. So I wish I would have made that initiative so that I wasn't so stressed going into my first year.
Is there any advice that you would give to people who are in high school that are interested in becoming a doctor, whether it's, I know that you already kind of mentioned people who want to go through the BSMD route, or people, in this case, this question is kind of referring to people who want to go into being pre-med in undergrad. Do you have any advice that you would give them?
Yeah, so you're right. I did kind of mention this early on. Knowing that you want to go into the health sciences or medicine um, from high school, from such an early position, that's half the battle right there, and more power to you. Because a lot of people don't. A lot of people need all of high school, and then um, all of undergrad, and then a few years after that, of whether or not, just kind of contemplating whether or not they want to make that commitment and take that leap. So if people know in high school, I would say that that's most of the battle right there. Um, Other than that, again, kind of differentiate yourself from your colleagues. I'm not really saying anything new here, but I'm trying to reemphasize these points because they're all equally important. Um, do things that will show to an undergraduate program, the college that you're applying to. Doesn't necessarily have to be BSMD or BSDO. That you are truly interested, that you're absolutely willing to make the commitment, and that you're willing to make the commitment over the long term, because this journey that you're embarking on is a decade long. So when I knew from high school, I had 3 years of undergrad, and then 4 years of medical school, and then uh, years after that for residency or fellowship. Like, this is a very, very long process. So you need to make it clear to these programs that you're applying to, um, that you're in it for the long run.
Finally, to finish off the interview, is there any last parting advice that you'd give to anyone that's thinking of becoming a doctor, or anyone interested in the field of healthcare, whether it's pharmacy, whether it's PA, because medicine is becoming more and more of a team sport, to say? So is there anyone or any advice that you'd give to anyone that's interested in healthcare in general?
Yeah, absolutely. I would say um, you recognize the diversity of the field of healthcare. I feel like there's this misnomer, especially with undergraduate students, that once you graduate medical school, there's a limited number of specialties, and once you choose those, you're kind of confined to that, and there's not much else. But I really don't think that's true. From clinical medicine to experimental medicine to medical ethics and medical policy to healthcare reform to patient advocacy, there is just so much that you can do, and so much that you can make out of medicine and out of the healthcare field. And what I would recommend to all students that are interested is find a concentration that really interests you and make that your passion. Um, and that way, you can really kind of familiarize yourself with all the corners and the nuances of the healthcare field.
Okay, great interview, Omer. I really thank you for taking out time out of your day. I hope you enjoy the rest of your break, and best of luck with your medical school journey, and we'll stay in touch.
Yeah, absolutely. Thanks again for having me, Salman. This is great.
Absolutely, man. Assalamu alaikum.
Walaikum assalam.